how do you get that environmental consciousness into the system is the question. The next area that we found were these occupational and community exposures to things. So the nurses who are exposed to chemotherapy. On the units where I was, this was a huge problem because a lot of other hospitals had at this time put into place, you have this chemotherapy bag. You need to somehow put the tubing in it so that you can deliver it into the patient's arm. A lot of hospitals put into place a controlled safety mechanism where it was a pharmacist actually spiking the bag is what they call it. You needed to have a little sharp instrument to plug that tube into the bag. A pharmacist was doing this in a hood so that there wouldn't be spray all over the place in a lot of hospitals. Where I was, the nurses were standing right next to the patient's bed and doing this. This was just their standard practice. And a lot of nurses were concerned about this because there had been times when one nurse in particular had spiked a bag and done it incorrectly. She was in a hurry and the whole bag just sprayed everywhere. Now you have a hazardous substance. Right on any chemotherapy bag there's the little orange sticker with the biohazard symbol on it. This is a hazardous substance. Now she has it all over herself. She has on a protective gown which is made of paper with a thin layer of plastic in it. So she said, this is the quote that I'm remembering, "I gathered it up into myself and tried to roll it up and called for another nurse to come and help me." They had to clean up the chemo that had fallen on the floor in the patient's room and on the patient's bed and probably on the patient themselves. So this is kind of an interesting question. The patient is the one who's getting the chemotherapy. They need the chemotherapy, but they need it in them, not on